There's such an interesting case being argued in the Supreme Court. The case is Kennedy versus Braidwood. Centers around whether the U.S. Preventive Services Task Force, which was established by the passage of the Affordable Care Act, is violation of the Constitutional Appointments Clause. And it's super interesting because a little small fringe group of people, the tyranny of the minority, are actually putting everybody's healthcare into jeopardy in terms of what would be a covered service, forcing the Trump administration to defend Obamacare and calling into question what an independent agency is and what the president's powers would be over that agency. A group of 4 individuals and 2 small businesses went to court in Texas to challenge a federal requirement that insurers have to cover preventive services because it included a prophylactic treatment for HIV. And the group was arguing that having access to medications to prevent HIV encourages homosexual behavior, intravenous drug use, sexual activity outside of marriage. Because they are opposed to homosexuality, they went to court basically saying that the U.S. Preventive Services Task Force, which was created by the Affordable Care Act, violated constitutional appointment clauses and had no authority to require preventive services at no cost to the individual. So if they win, that would mean health insurers are no longer mandated to follow the guidelines of the task force, which would mean not only is there no HIV prevention medication, but depression screenings, flu shots, mammograms, prostate screenings, all those preventive care services, which are mandatory and have to be covered at no cost for all people, none of that's valid anymore. So the members of the task force are appointed by the Secretary of Health and Human Services, and they are supposed to be an independent task force. And the lawsuit hinges on the claim that the structure of this task force is unconstitutional because the members are not appointed by the president and confirmed by the Senate. This meant the Trump administration basically had to go to court to defend the task force, saying that Health and Human Services Secretary exercises enough control over the members that they do not need to be nominated by the president because the Secretary of Health and Human Services can remove members from the task force at any time. But if the secretary can remove members at any time, then that actually supports the argument that this is an unelected political body, which is what the lawsuit alleges. And this is all coming at a time when President Trump and his allies are disbanding lots of other independent regulatory bodies. It's super interesting to see how this very small group of fringe people who thinks that this task force is approving medications that are going to turn people into homosexuals is now jeopardizing the healthcare services and the cost of those services of basically everybody in the United States.